Hey guys, Justin here with a new live video and a fun little announcement. So we are going to bring back our Fitness with Feldman podcast and a whole bunch of other fun stuff that we're going to do across all different channels. So we're going to have the podcast coming back through that sort of channel medium. We're going to be coming with some weekly live videos here, and what we're going to do is we're going to use some of the audio from the live video here in order to make our podcast, and we're going to sort of cross promote everything throughout Instagram and Facebook and all around different channels. We want the topic to sort of change a little bit, and so you notice we haven't posted a new podcast video in a while, and I think part of it was that the whole topic of fitness and everything that we were talking about, we almost sort of ran out of stuff that we could talk about that was new, different, and exciting. And so we decided to bring this back now as we have some new stuff that we want to talk about. So we want to start to focus on more of these wellness side topics. And when I talk about wellness, I don't necessarily mean what you think about as far as a normal like corporate or kind of like community-based wellness plan. We want to start to talk about what you can do, and then also what different types of healthcare professionals can do, and what we can do as a community to try and just improve the overall way that healthcare and things sort of get delivered, but also the steps that you can take to basically keep yourself out of our office, out of any sort of, kind of basically out of the medical system, and really actually start to focus on keeping people healthy sort of and well. And I think that we use a lot of analogies in the clinic. We talk a lot about the way things are done in professional sports, and I don't think necessarily everything done in professional sports is sort of the model that we want to do. A-Rod's a good example of that. But I think that if we look at sort of the way that the healthcare sort of system that's set up around these players is done, one of the things is that their providers and the people that work with them, they're basically paid, the PTs and the trainers and the doctors, they're paid to keep these people out of their office, as opposed to paid more the more that they're in their office, which is sort of the way that the more standard part of the healthcare system works. And so, we set up our practice in a way that, we try to minimize the amount of time that people need to come in and see us and work with us in the clinic. But even that's not the perfect setup and the perfect model, because while it's great for us to be working with one person at a time, and it's really great to be able to get that attention from the patient's standpoint, it's also just limited in the amount of people that we could impact and the amount of people that we can work with. And so we're hoping to use some of these platforms to grow that a little bit and sort of grow that influence around. We start to, we go back to that sort of pro sports model, and you look at it, and basically, the term sort of gets thrown around in the news a lot all the time, but, really it's more, we're currently working in more of like a sick care type model where the more tests that people have run on them and the more times they go into a doctor's office or any healthcare professional's office, the more dollars that group or person or company or whoever you're working with stands to gain. And so basically the motivation is just sort of not there. And that's why a lot of this sort of falls on individuals and what they can start to do in order to get that to work. I think for a while we saw, a lot of like wellness programs popping up places, and this whole idea of, take 10,000 steps a day or all these things. The problem is that a lot of them take you and work on a specific thing, but then you end up kind of popped back into the exact same situation that you were in before. And so like diets are a really good example of this, where if you are doing a specific type of diet, whatever that might be for you, and then you go right back into the same family and community and all the other things that you were in before, it's really hard to stick to that same diet, because that was sort of the environment that led you into whatever you were in before. And that's where I think a lot of these workplace wellness programs don't do great. We can look at sort of like, all right, what happens when we start to look at different risk factors? And I think, heart disease, diabetes, they're sort of a good example. Doctors, health professionals all over the place are well versed in what the risk factors are for these different diseases and conditions, and you go for your annual physical, and they're constantly looking at these things, but the rate of them keeps going up, and so the population's going up, but even when you start to keep everything together, the rate's going up. And so what can we do better to start to find better solutions for these things? And we don't necessarily have all the answers, but this is the discussion that we're looking to start with these new sort of videos and podcasts and the different things that we're looking to do. And so the big thing is we need sort of engagement. We need people to jump in and give us their opinion, hear some ideas of things that you want us to talk about. I think when we were doing more of the fitness topics, it was great. We'd get a lot of feedback from people looking for new things. And so I think that I've been having this conversation a lot with people recently, had it almost twice this morning while we were, doing our morning run. And so that sort of pushed me the idea that I think if I'm having this conversation with a bunch of people over and over again, it's sort of like when you're in a group or in a class and you say, like, the teacher says, if you have a question, ask it out loud. Someone else probably has the same question. And so clearly other people have these questions, these thoughts, and sort of what's going on. And so I don't necessarily have all the answers or any of the answers, but I think it would be fun to work through it with everybody and talk about it, and kind of promote the idea that there are solutions out there. There are things and ideas. And so we're going to sort of strive to have different people from all walks of different areas on to talk about different things. I think that the rising cost of healthcare is people's monthly or biweekly cost for your health insurance goes up, your deductible goes up, all these things go up, and I think that that sort of market pressure is going to force people to have to do better on their own at staying healthy. And so I think this is a good time to look at this. I know, talk to some people who basically will get a raise from their employer on a yearly basis, but sometimes in some years the amount of money they take home in their paycheck can actually go down because their cost of their healthcare went up, and so their employer gave them a raise, but it wasn't even enough to cover how much their health insurance increased. And so these are all the different things that we want to talk about and go through. And so I'd love to hear from people, specific areas they want to learn more from. So go ahead, comment below, however you want. And we're going to post this up on iTunes, and it'll be on the Google Play podcast store. So that'll be up as soon as I figure out how that works. And we'll have a blog post about all this, and get this over onto Instagram and a couple other channels at the same time. So I am going to wrap up for now from our backyard. And the other fun thing about this project is if I do all of these from the same spot in the backyard, you can see the seasons change in the leaves and everything behind us. So, and it keeps me motivated to keep the backyard clean. So enjoy, have a great rest of the weekend, and a great week.